Hi, I'm Kim. I am a licensed clinical social worker and I'm also a sex therapist. I work at the James Graham Brown Cancer Center. I'm a social worker with the breast cancer team. So I work with women of all ages and a few men, but mostly women. And I really try to focus on a lot of the needs of younger patients because it seems as though we have a lot of young women diagnosed with breast cancer. And it's not to say that the needs of older breast cancer patients aren't important, because they certainly are and they overlap a lot, but younger women, they come to us with lots of things that are different from their older counterparts. You're young, you're starting careers, you're starting relationships, you're either thinking about having children or you have small children. In some cases, you're pregnant. So there are a lot of things that are different when you get that diagnosis at a young age than when you get that diagnosis at an older age. So I don't know that a lot of physicians and a lot of people are really I think they're catching up. I think they're getting in tune with that. But historically, they've not been in tune with that. You're a woman, you have breast cancer. Here's what we do, and here is how we're gonna help you. Well, those things I mentioned are just much different when you're a younger person. And one of the things I saw that really bothered me is we weren't talking to women, young or old, about sex and about how having this breast cancer diagnosis is really going to change your life from a from a sexual health standpoint. It does older women too, and I'm not saying I don't talk to older women about sex, because good God, I hope you have sex until you're 110 or however old. But it can be a little bit more of an issue with younger women, and some of that is because if you're younger, you may not even be in a long-term relationship. You may be in a dating situation, and you think, oh my gosh, how this really is going to complicate my life as a single woman. And what if I want to have sex with somebody? What if I want to have a relationship? And how do I navigate that? Or you're newly married, or you're in a new relationship, or whatever that looks like for you. And but it's hard. It's a different kind of situation when you're younger. And so I went and became got particular certification for to be a sex therapist, because I wanted to be able to have these conversations with women and make it more a part of a normal. We talk about everything else that's going to happen when you have treatment for breast cancer. This is one of those things that we need to talk about. There were studies done, and it's something like 2/3 of women, when we're asked about, do you bring it up to your physician? Have you ever brought up sex, or did you ever? And 2/3 of them say, no, I never brought it up. If they don't bring it up, I'm not comfortable with that, or it must not be an issue. So 2/3 of women don't. And conversely, they asked oncologists in a different study, do you bring that up? Do you bring up sexuality and sex with your patients? And guess what? 2/3 of the medical oncologist, or of the oncologists that were questioned, said no. If they'll bring it, if it's an issue, they'll bring it up. So you have 2/3 on both sides, and you're just waiting on each other. Ask me the question, and then it doesn't happen, and then you just go on wondering. Doctor never knows it's an issue. So it's my role when I meet with new patients, particularly younger patients, but it's one of those things it's on my business card, sex therapist. So, so I explain that and what that means, because I don't ever want someone to feel like I shouldn't bring it up, or I can't bring it up, or I'm silly for this because I have this life-threatening disease and here I am worried about my sex life. No, that's not cool. Bring it up. So if you have a diagnosis of breast cancer, and you all do, and particularly at a younger age, when you're younger, well, the way it's supposed to happen in the natural scheme of things is, you're a young woman, you have lots of estrogen. Estrogen does lots of good things. It lubricates you when you get aroused. It it stimulates the brain to help get you aroused. It, on a regular basis, provides moisturization to your vagina. So that's why you never have to worry about that. It does all kinds of great things. So you ride in that for a long time, and then around, I don't know, 45, 50, menopause starts to come in, and then your estrogen levels start to do this. They start to drop a little, drop a little. That's when you get the hot flashes and the mood swings, and all of that stuff that you've heard people talk about that goes along with menopause. So if you have estrogen driven breast cancer and you have treatment for that, and one of the treatments is an anti-estrogen pill, you're up here swimming in estrogen, and then suddenly pew, down here. So it's a very different phenomenon, and it can be very alarming. And a lot of those symptoms you're going to experience. One of them is loss of libido, because the estrogen is floating around there on that cerebral cortex of your brain, telling you, whoo, look at this, look at that, touch this, touch that, lick this, and it's exciting. It's just, and the other thing the estrogen isn't doing, it isn't moisturizing you. The estrogen, it keeps your vagina, like, I hate the word moist, I don't know what else to say. There's so many others, but they're all bad. So it moisturizes your vagina. So, on a regular basis, not whether you're aroused or not. And so that stops happening. So you get vaginal dryness, and whether you're having sex or not, that's painful. It's not a comfortable thing. So there's that. And if you try to have sex when you are dry, and it hurts, and it's not something you want to repeat often because it's painful. The other thing is, at the moment of arousal, when you come together with your partner or with your magic bullet or your whatever it is you come together with, the physical body, your physical self does things. That's estrogen. You become engorged, and your clitoris. If you don't know where your clitoris and your labia and your vagina is, go home and get a mirror and find that stuff, because it's important to know. So what happens when estrogen hits that all sort of loosens and becomes engorged. And we think of that as a penis, but it happens to the vagina, and lubricates. All right, that's a young woman's body with full estrogen. Those are the things it does, and allows for whatever penetration, whatever is going on. That's just how our bodies work. Without estrogen, that doesn't usually happen. So there's no lubrication. So you're dry. There's no necessarily the opening and engorgement where it kind of, your body just sort of naturally makes way for a penis, erect penis, or whatever else, So without estrogen, you don't have all that happening naturally. And if you try to have sex and that's not happening, then it's going to be really painful, and it's going to be something you don't want to do again. You may try it a couple times, and then you're going to say, no thanks. So over time, you're going to start figuring out ways to not have to be in that position. And so what used to be really sweet, your partner calls on the way home and says, I'm going to stop and pick up a bottle of wine. Maybe we can watch a movie or something. Well, that is code, because that's always been the code for, it's just the two of us. We're going to watch a movie. And then, then there's going to be, it's implied there's going to be sex. And that's what would start that feeling of, with the estrogen, that feeling of excitement, and that almost kind of little, tingly feeling. It starts some of that, those feelings. And then you have your wine, you watch your movie, and then you are just primed and ready when the movie's over, maybe not even, for all of that stuff to happen. Boom, boom, boom. Woo! Happy days. Without estrogen, you're dry. You're not lubricating, no matter how much you really want that. It has nothing to do with the fact that I love this person, or I don't love this, or I want to have sex with this person, or I don't. It has to do with your body physically is not making the things that's going to make you lubricate, make you wet, make that engorgement happen, and so you have to do that, yourself in a lot of ways. And that's hard sometimes. It's hard for us as women, because we think that's what makes us women. It's like, oh, look what I can do. My body reacts this way and it feels so good and it's so sensual. And your partner is like, yeah, all I gotta do is touch her hair and lick there and caress here, and she's just wet. Those are the things that we tell. And when that stops happening, we don't think, oh, her estrogen isn't pumping in the correct ways any longer. And it is more, what's wrong with me? Why am I not able to arouse her like I once did? We make it about ourselves because that's, what people do. So some of the things that you can counteract that. And so it's my goal in our clinic that I'm going to talk to women the minute before they even get on that medication and say, look, this is more often than not what's going to happen. I'm not here to say that it's 100%, but more often than not, you start this anti-estrogen medication, you're going to have vaginal dryness. It's going to be painful. It's not. So here's what you can do to counteract that. There is vaginal moisturizers on the market, not lubricants, has nothing to do with sex. Having a vaginal dryness is painful whether you're having sex or not. It just gets irritating. So Replens, over-the-counter vaginal moisturizer, and you use it every 3 or 4 days like clockwork. Doesn't matter whether you're having sex or not. It comes in a pre-filled applicator. Insert it at night every 3 or 4 days, and it kind of adds back that moisturization that is lost. And it's the best explanation of it is like when you wash your face. Every night we wash our face, and your skin's kind of dry, so you put moisturizer on it, and we do that. It's routine. We don't blame ourselves. Oh, my face is dry, I'm a bad person. We just moisturize it and go on with life. So the same thing now with your vagina. It needs some love, and you need to moisturize it. At the time of, if you're going to have sex, if you're going to have penetrative sex, then you're going to have to lubricate, because again, that extra, estrogen wash of arousal and excitement and tingling that leads to that lubrication isn't, it's just probably not going to happen like it used to. And again, that can be psychologically a little off-putting, but it is what it is. So you have to keep the little bottle of Astroglide, okay, whatever your lubricant of choice, and you lubricate the hell out of that thing, because otherwise it's going to hurt, and you don't want it to hurt. So vaginal moisturizer and a lubricant, and that's going to help probably take care of some of that issue with the pain of sex. Couple of other things, you might do well to think of taking penetrative sex not off the table completely, but remove it, put it on the back burner, and say, you know what, we need to reconnect body to body, whatever it is, whatever you're doing, and penetrative sex doesn't have to be the goal. If you have a sexual encounter with your partner that doesn't end in penetrative sex, that's not a failure. You did not fail, and they did not fail. So just take that off the table and make it just make it not a thing. And if it happens, it happens. If it's great, great. If it doesn't, it's not a failure. Some of the other things that can get in the way, those are very physical things and just physical things that happen. Other things is we just don't feel feminine. We don't feel like a woman, the woman we used to be. If you've had mastectomies or if you've had lumpectomies, you may very well feel, like you don't want anybody to look at you. I don't want somebody to touch me. It's hard. It's hard to see ourselves and see our body, particularly our breasts, gone or left with scars. And, our breasts are they're very sensual. And by sensual, they can be sexual, they can be nurturing. Some of you have fed your children with your breasts, and you've hugged your children, you brought people in and hugged them tight into your breast, into your chest. And of course, you've been sexually aroused by them. So there's a lot of meaning and a lot there that isn't a matter of, since I've heard people say, oh, it's okay. They'll take them off and you'll just get better ones. You'll get new ones. Okay. Sometimes people say things, they're trying to help, but that doesn't help because it's not the same. and then you can have a beautiful reconstruction. And, it's still not going to be the same. But what you have to do, sorry about that, at that point, you have to work really hard to reacquaint yourself with your new chest, your new breasts, whatever that looks like. And you need to, you have to get to know it. You have to love it and feel it and touch it and find new spots that feel good for you. So, and that can be, that can be daunting. That can be hard. It can be very emotional. It is grief. You're grieving the loss of not the person you were. You're grieving this one particular loss of something that brought you pleasure, something that you, in some cases, something that you were proud of, or that you loved, and that your partner loved, or your multiple partners loved. Everybody in the world loved my breasts, but it's no easy thing. It's not a matter of like, get new ones. It's a loss, and you need to grieve that loss. And then you need to get to know your new self and find where that makes you happy. I'm willing to talk to anybody at any time, and you will be given some information on how to contact me. Feel free to email me or call if you want to, and I'll answer any questions. But if I leave you with anything, just know that you may hit a spell where feeling sexual and having sex or being sexual isn't where you are, and that's okay. Just talk to someone about it. Talk to your partner if you have a partner. Find a friend. Find your social worker at your cancer center. But you need to get some reality check, because this is not an area where you do well in your own brain, because there's a lot involved there. So you need someone who can really talk to you, and that you can really talk to about this stuff, because you deserve to have good sex. Don't let cancer take that from you. Cancer takes stuff, and it's merciless in what it takes. It does not have to take this. You are still a woman. You're still feminine, and you still deserve and still will have a good sex life. So hope that helped. You all have a good rest of your session. Sorry I couldn't be there with you, but peace.